My name is Evelina Ginevičiūtė, and I am oral surgeon from Vilnius, Lithuania. And actually, honestly, it's a very big pleasure and honestly to be here with you all. So let's enjoy this time together. And I made yesterday a big mistake because I didn't say thank you for my mentor, for my teacher, for my critic, for my everything, for my science father. So thank you, Tomas Linkevičius, for being with me almost 10 years. And now we can start our presentation. So take a look at this. A successful tooth extraction with previous infection. And in the end, we have this. Bone resorption like this. Is this what we want? Is this our success? And I hope that most of you would say no, because when implantation and infection is two things that we didn't want to bring in one, yes? But look at this molar and look at this infection. If you want to look a little bit closer, this is a TBC scan of this. And look how big infection we have here, how large it is. It's already connected to inferior alveolus nerve. And it's usually then, if we have infection, then healing, and then we have bone loss. And it's normal for us, yes? It's unavoidable. But what if I would say that implant placement into infected site could even be better and make better your results? So infection for us, it's like red flag, yes? Something that makes us to stop, reconsider, or even delay our procedures. So when infection meets implantation, we are saying no, right? But today, I want to be like this black sheep and to say yes for infection. So let's meet my patient, first molar. So this is the same molar I showed you before. This molar, this infection. So I said yes for this infection and for immediate implantation. And actually, yes, you cannot agree with me that we need to make implantation here, right? But I think that all of you will agree that we need to extract this molar, yes? And we need to make it carefully and atraumatically. Next, super important step is cleaning and disinfection of the socket. Because when we have infection, cleaning becomes critical. And I have a question for you. Is this site still fresh from infection? Can be good place for implantation? So what science is saying about this? Now I will show you two main studies that demonstrate that infection is not contraindication for implantation. So in this, you can see that we have almost 98% of success when we are placing implant in infected site. In this, we can see that there is no significant difference at all. So with this information, we can go back to our case and what we have after extraction and what we have after disinfection and cleaning. We have just a big, big hole here, and we have zero bone apically. We can see only a nerve bottom, yes? So to illustrate how deep it is, I placed just a drill from the surgical kit, and we see that the depth is almost 20 millimeters. It's almost 2 centimeters of hole. So in this stage, we are dealing not only with infection. The question is how to make implantation here and how to get primary stability here. So for the help comes wide implant. And I know that part of doctors don't like this implant, yes? They are always saying, please stop using wide implant because you will have failure, you will have complication, and that's it. But I don't agree with this. Because if you know how to use this wide implant, then it's predictable and successful treatment. For example, in this study, you can see that after 7 years, we have only 0.19 millimeters of bone loss. So it's nothing. So as you can understand, I put here a white implant just in the middle of the socket. And what about primary stability here? So it was perfect. This was more than 50 newtons per centimeter. And I want to highlight one more time. White implant is safe to use, but you have to know how to use it. So you have to place it deeper, 5 or even 6 millimeters below free gingival margin. Then you will be safe. And yes, it's immediate case, yes. So if we want to preserve our soft tissues, we have to make a bone grafting, yes? And I think that you want to ask me, infected site, acute inflammation, is it not too risky to make bone grafting here? Is it safe? And I can answer you that if you want to have a good profile, and if we made a proper cleaning and proper disinfection, yes, it's safe and you have to make it. And in the end, we place just a healing abutment. And of course, I could make individual healing abutment or to put anatomy healing abutment, but I put just a standard wide healing abutment. Why? Because it fits. It fits perfectly. So you want to look how it looks after surgery? And it looks like this. And I agree with you, it looks risky. It looks dangerous. It looks crazy because implant is just hanging in the air, yes? But be patient and wait. So 4 months, and what we have this. So it's perfect healing. We managed to keep our soft tissues, our bone, and patient also has no complaint because he has no pain, no swelling, nothing. Just 4 months. And 0 infection, 0 absence of infection, 4 months. So I think that most of you would not do this surgery. Why? Because it's infection, because we don't have bone here, yes? But look what we have when we did it. So now we just need to make a final crown. And our crown is from zirconia, it's screw retained. And I want to repeat myself one more time. 4 months, easy implantation, fast implantation, and we have this. What about X-ray? So after 4 months, we still have implant here, yes? We still have it. Our bone graft is here also. But what is also very important, look at this place. Look, our bone is healing. Our infection is healing here, 4 months. What is happening after 4 years? So we can see that our bone is completely healed. Any infection, our implant is still here also. Any bone loss around our implant, 4 years. And maybe you can answer me. Could we enjoy results, so stable results like this, without making this surgery? Instead of making big, long-lasting, painful surgeries trying to reconstruct the bone. And I'm sure that someone of you is thinking that, yes, it's incredible. Yes, it's wonderful, but it's just one case. And maybe it's just a lucky outcome, yes? And yes, you are right, because one case doesn't prove much, yes? So this is why I want to save myself a little bit and to show another case. Another patient, another molar, same infection, even bigger infection here. So again, patient come to us with pain, with swelling, with everything, with big eyes looking at me and saying, please, doctor, do something. And we have 2 solutions here. Extract, disinfect, and become a best friend with this patient for 1 year trying to put the implant later, or to make immediate implantation here. So as you can see, we made the implantation here, and with wide implant again. Because without wide implant, I cannot do surgery like this. So the same principles, deep enough, and the primary stability was also perfect. So again, bone augmentation in this case, and I put here individual healing abutments. 2 weeks later, what we have? No infection. We managed to keep our contour. Everything is in the place. So this is 2 weeks. Do you want to look how it looks after 2 months? So it looks like this. 2 months, and we have perfect profile. What about implant? Is still there. So we wanted to test it, and we tested, and it was 72 ISQ. What does it mean? It means that our implant is fully integrated. So now we have to start our prosthetic part net, and delivery after 2 months, just 2 months. I'm showing you the results. Again, everything is in the place. We have crown, we have contour, we have soft tissues, we have bone. We don't have any infection here. So you don't want results like this. And actually, I called for this patient 1 week ago because I wanted to make x-rays, photos for you. And she said, "No, doctor, I'm not coming. Everything is good." "No, Elena, you have to come." "No, doctor, I'm not coming. You need money or what?" "No, Elena, please come." And she came, and I can understand why she didn't want to come. Why? Because everything is good. We managed to keep everything after 5 years. Look at the gums, look at the papillas here. Everything is stable. So what about x-rays? X-rays we see, again, the same. Our infection is healed. We don't have any bone loss here, and we have stable implant here, 5 years. So from this to this in 2 months. So in the end, I want to say, I think one thing, that please try to make your complications into your success. And then you will be happy, and then you will be enjoying what you are doing. So if you will be enjoying what you are doing, you will be happy, your husband will be happy, your wife will be happy, your assistant will be happy, your patient will be happy. So enjoy. Don't be afraid to take a risk, because you don't have a boundaries. So thank you.